This is an educational video for professional eye doctors and surgeons regarding your upcoming cataract evaluation. In preparation for your upcoming cataract evaluation, please start using artificial tears 3 to 4 times daily for the week prior to your appointment. Similarly, please be out of all contact lenses for at least 1 week before your appointment. This will help obtain more accurate measurements and test results. Finally, notify any staff during your visit if you have ever had laser vision correction surgery, such as LASIK or PRK. So the first question is, what is a cataract? Well, to begin with, we are all born with a clear lens in our eye. This is the blue structure that is denoted by the red arrow. And this lens focuses all the light to one single point, which allows us to see clearly and sharply. However, with a cataract, that clear lens that was denoted by the red arrow becomes more cloudy. What that does is it scatters the light so that it hits different parts of the eye that we are not accustomed to, and this results in significant glare, blurry vision, and dimmer vision. You can see the comparison between the two eyes. The left eye has a normal lens, and the right eye has a cloudy lens, which we then call a cataract. Now, when we examine the eye at the microscope, we have a similar image on the left, and with a clear lens, we see a dark pupil where all the light passes through, and this is equivalent to a clear image which you see on the right-hand side. A cataract begins when that dark pupil becomes cloudy. It normally starts off slowly with just a slight opacity that barely blurs the vision. However, as it slowly progresses, usually over the course of months, years, or decades, then that pupil becomes more and more cloudy, resulting in blurrier vision. In its final stages, the pupil can become so cloudy that light cannot pass through it, and this results in a loss of functional vision. So now that we know what a cataract is, the next question is, how do we treat it? Now, unfortunately, there are no proven medications or therapies that can cure a cataract. So the way that we treat it is with cataract surgery. During cataract surgery, we begin by making microscopic incisions and accessing the cataract. Then, we can use ultrasound energy to emulsify the cataract and remove it. Now, in the place of the cataract, we place a clear man-made lens. So the next question is when to have cataract surgery. The nice thing about cataract surgery is that it is an elective procedure, so we just proceed when you feel that the benefits of surgery outweigh the risk. Now, most people wait until they feel that their vision is being impacted with their daily activities. However, we will review the risks, benefits, and alternatives of the surgery in detail so that you can have all of the information to make the right decision for you. Before talking about risks, though, first I would like to say that cataract surgery is extremely safe. With over 3 million cataract procedures performed each year in this country, it is one of the most common and successful procedures. But to discuss the risk in detail, any surgery in medicine has a risk of infection, bleeding, or inflammation. And because we are working inside the eye, naturally we have to warn there's a rare chance of vision loss or damage to the eye's structures. This can include the cornea, the front part of the eye, which can affect vision or sensation. The zonules or the capsular bag may also be affected, which may limit our ability to place an intraocular lens or prevent complete removal of the cataract at the time of surgery. Damage to the iris may cause light sensitivity or change in appearance. Vitreous, retina, or optic nerve damage may affect vision and require further intervention with the retina specialist. Thankfully, though, severe or vision-threatening complications are extremely rare, especially in my experience. However, the most common issue after cataract surgery is often dryness, and usually some level of dryness exists prior to surgery. Finally, many people ask if cataracts grow back. The answer is no, they should not grow back. However, sometimes as our bodies heal, months or maybe even decades later, we create scar tissue over that clear lens that was implanted, and this can be treated with a simple laser procedure in the future. You do not have to go back to the operating room for this. The benefits of cataract surgery are usually straightforward, with the goal of improving vision in an effort to help with daily activities. This improvement in vision can occur by reducing glare, increasing sharpness of vision, or by improving colors. And naturally, the alternative of the surgery is to not have surgery. And sometimes this means that glasses may be able to help our vision in the interim until we are ready for cataract surgery. So if after considering the rest benefits and alternatives of surgery, you do not feel that you are ready for cataract surgery, then you can stop watching this video at this point. However, if you feel that the benefits outweigh the risk, then the next question is what type of lens to put in the eye during cataract surgery. It is standard to place an intraocular lens at the time of cataract surgery. When cataract surgery was first starting, we initially did not have lenses to place in the eye, and it resulted in the need to wear Coke bottle thick glasses after the surgery. Now, thankfully, we have the technology and it is standard to have a lens in the eye. There are three main types of intraocular lenses, also called IOLs. There's the standard IOL, which is covered by your insurance, the Astigmatism-Treating IOL, or the Presbyopia-Treating IOL. First, we will talk about the standard IOL that your insurance covers. With this lens, you get one main target distance that you see clearly. Most people typically choose between seeing well at a distance, as you can see on the simulated vision example on the left side. Now on the left, you will notice that the TV image is clear to simulate good distance vision. However, on that side, it is difficult to read the print off of the brochure. So in this case where distance vision is selected, then reading glasses will be needed. The other option that people choose is to see well up close without glasses, as you can see with the simulated vision example on the right side. Here you will notice that while the print of the brochure is clear to read without glasses, the TV is blurry. Prescription glasses will be required to see things well at a distance with this choice. When selecting whether to see better at distance or near without glasses, it is important to consider your current vision, determine if you would like changes, and determine which activities are most important for you to be glasses-free during. Now, it is very important to note that this standard lens vision simulation only applies if you do not have significant astigmatism. This is denoted on each vision simulation on the upper right-hand side. Now, if you have significant astigmatism, then the standard lens that your insurance covers will not treat this, resulting in blurred vision at both distance and near without glasses. The reason this occurs is because of the shape of the front of the eye. Normally, as you can see on the left side, the front of the eye or cornea is completely round and circular, and this allows you to have a sharp image with the E shown there. However, with astigmatism, there are oval-shaped lines on the cornea. This creates distortion, which creates a blurred image, as you can see on the E. Now, it's important to state that glasses and contact lenses can fix this astigmatism. However, for those that would like to be less dependent on glasses and contact lenses, the Astigmatism-Treating IOL or Toric IOL is an option. However, medical insurance does not cover this lens, so it is an out-of-pocket cost. With that lens, you will notice that it makes the distance TV clear. However, please note that up-close vision will still be blurry and often require reading glasses. Similarly, sometimes people may use this lens to make the up-close vision clear, but then they still need glasses for distance as well. Our final category of lenses involve presbyopia-treating lenses, which help get you out of glasses and contacts for both distance and near vision. However, once again, insurance does not cover these lenses. While they are great options for people that are highly motivated to get rid of their glasses, there can be some drawbacks due to the inherent design of these lenses, which include halos around lights at night and some decreased contrast sensitivity. In addition, the eye has to be very healthy to do well with this lens. We can discuss this lens in more detail if you are interested in your appointment and determine if you are an appropriate candidate for it. That concludes our brief introduction to cataracts and lens options. Once again, please remember to use artificial tears 3 to 4 times a day for 1 week prior to your appointment. Make sure to be out of your contact lenses for at least a week, and please notify the staff if you've ever had LASIK or PRK.